Welcome. Today we're diving into a fascinating, albeit rare, eye condition, ghost cell glaucoma. This secondary glaucoma occurs when ghostly remnants of red blood cells clog the eye's drainage system, leading to increased pressure and potential damage to the optic nerve. Join us as we explore its causes, effects, and management. The primary cause of ghost cell glaucoma is the presence of ghost cells in the anterior chamber of the eye. These ghost cells are degenerated red blood cells that have lost their hemoglobin and taken on a characteristic shrunken, rigid appearance. The most common source of these cells is intraocular hemorrhage. This hemorrhage can result from various conditions, including vitreous hemorrhage with disruption of the anterior hyaloid face, trauma to the eye, or following certain surgical procedures like cataract surgery, particularly in individuals with pre-existing conditions like diabetic retinopathy. Let's understand how these ghost cells lead to glaucoma. After an intraocular bleed, red blood cells break down. When the anterior hyaloid face is compromised, these cells can enter the anterior chamber. Macrophages, the eye's cleanup crew, attempt to remove these degenerating cells. However, ghost cells are relatively rigid and less deformable than normal red blood cells. They can obstruct the trabecular meshwork, the eye's natural drainage system. This blockage increases intraocular pressure, eventually damaging the optic nerve, the vital link between the eye and the brain, thus causing glaucoma. Ghost cell glaucoma is considered a relatively rare condition compared to primary open-angle glaucoma. It typically occurs in individuals who have experienced significant intraocular bleeding. While specific population-based prevalence data is limited, it's understood that individuals with conditions predisposing them to eye bleeds, such as diabetic retinopathy or those undergoing complicated eye surgery, are at a higher risk. The exact incidence is difficult to pinpoint, as it's often underreported or misdiagnosed. The signs and symptoms of ghost cell glaucoma can vary, but some common indicators include elevated intraocular pressure, often detected during routine eye exams. Patients might experience eye pain or discomfort, blurred vision, and halos around lights. In some cases, the cornea may appear hazy due to the elevated pressure. A key diagnostic sign is the presence of reddish-brown or khaki-colored cells, the ghost cells themselves, visible in the anterior chamber during a slit lamp examination. Diagnosing ghost cell glaucoma requires a thorough eye examination. A key diagnostic feature is the presence of ghost cells in the anterior chamber, which are seen using a slit lamp microscope. The doctor will also measure the intraocular pressure, perform gonioscopy to assess the drainage angle, and evaluate the optic nerve for any signs of damage. Other tests, such as visual field testing and optical coherence tomography or OCT, may be performed to assess the extent of any visual field loss or optic nerve damage, respectively. Ghost cell glaucoma isn't generally classified into distinct types. It's primarily considered a secondary glaucoma, meaning it's caused by an underlying condition, in this case, the presence of ghost cells resulting from intraocular hemorrhage. The severity of the glaucoma can vary depending on the degree of trabecular meshwork obstruction and the duration of elevated intraocular pressure. The primary goal of treatment is to lower the intraocular pressure and remove the ghost cells from the anterior chamber. Treatment options may include topical glaucoma medications like eye drops, oral medications, or in some cases a combination of both. Anterior chamber washout, a procedure where the eye is irrigated to physically remove the ghost cells, may also be performed. In more severe or refractory cases, surgical interventions like trabeculectomy or glaucoma drainage devices may be necessary to create alternative pathways for fluid drainage. Preventing ghost cell glaucoma focuses on managing the underlying conditions that can lead to intraocular hemorrhage. This includes careful management of diabetes to prevent diabetic retinopathy, prompt treatment of eye injuries, and meticulous surgical technique during eye surgery to minimize the risk of bleeding. Regular eye exams are crucial for early detection of any potential problems. The prognosis for ghost cell glaucoma varies depending on the severity and duration of the elevated intraocular pressure, as well as the promptness and effectiveness of treatment. Early diagnosis and intervention are crucial to minimize the risk of permanent vision loss. Recent research has focused on improving surgical techniques to minimize intraocular bleeding and developing more effective ways to remove ghost cells from the anterior chamber. Studies are also exploring the potential of new medications to reduce inflammation and improve trabecular meshwork function. While ghost cell glaucoma presents unique challenges, continued research offers hope for improved management and outcomes.